edition of SOT events, and the first one that is fully virtual, hence covers audiences from all over the globe. The non-profit SOT event series was launched by Beacon House in 2000 as part of its CSR and to help inform the direction of the organization, while also engaging global communities in conversations shaping the future of schools and societies. This session, as you already know, is a debate, and I'm Amber Noor Mustafa, the moderator for the session. A proud former student of Beacon House, I am currently serving as the Regional Senior Manager, Professional Development and School Improvement at Beacon House School System. I have been associated with academia for the past 18 years. I have recently been awarded the Fulbright PhD scholarship, and I plan to start my doctoral research at the Florida State University this fall. Needless to say, COVID-19 has taken the world by storm. The cost in human life has been unimaginable by any definition of a catastrophe. However, a second dimension has also come to the forefront of political debate, an economic one. All throughout this planet, people and governments have been forced to make an impossible choice, one between lives and livelihoods. The infamous lockdown has been widely instituted across the globe as a countermeasure to the deadly coronavirus. But to lock down on one hand is to lose millions of jobs and billions in productivity. But to stay open on the other hand means to sacrifice thousands, if not tens of thousands of lives. What should our modus operandi be then? This debate will revolve around identification of behaviors and measures that need to be established to stem the spread of the virus and at the same time ensure social safety or suggest at least possible solutions which will lead to economic stability. Ladies and gentlemen, the debate is going to start with an audience poll. Yes, have I taken you by surprise? Well, your opinion matters. So please let us know what you think. Are you for or are you against the motion? Please participate in the poll by signing in through live.sotevents.com. The poll has been enabled now. You can see a tab at the bottom of your screen. It says poll. Please share your choice with us by clicking on it. Now you have to decide if it is more important to save people's lives due to the pandemic or to save their livelihoods of the same people. We may soon be facing a dilemma, a terrible choice to either severely damage our livelihoods through extended lockdowns or to sacrifice the lives of thousands, if not millions, to a fast-spreading virus. Nobody wants to have to make this choice, and we need to do everything we can to find possible solutions. Was Pope Francis right to say that people are more important than the economy? Can we sustain an economic shock without causing human suffering? How do we balance the seemingly competing yet equally compelling forces of protecting lives and saving global economies from complete obliteration? Now, some very interesting results coming up, but I'm sure while you are as intrigued, I'm sure, but I'm going to leave it to that. I will be sharing the results after the post-debate poll, and then we will see how your opinions have changed at all. Now, in this debate, there are two representatives for each side of the House, the proposition and the opposition. We have with us four eminent and seasoned debaters who bring with them a plethora of knowledge and experience in their fields and have actually seen the impact of the pandemic very closely. Starting in no specific order of priority, let me introduce the proposition consisting of Mr. Manik Elahi and Mr. Ali Hannan. Mr. Manik Elahi currently serves as a legislative professional in the office of New York State Senator Kevin S. Parker. Prior to this, he worked at the State University of New York and in the Executive Chamber Lieutenant Governor's Office for New York Governor Andrew M. Cuomo's administration. As a student, he won several debating awards, including many at MUN conferences, and served as a judge at Pakistan's National Under-19 debating tournament. The second member of the team is Mr. Ali Hannan. Mr. Ali Hannan is currently a Cambridge International Global Perspectives and Research teacher and debating coach at a branch of Beacon House School System. He has several accolades to his credit as a debater, including being the winner of the National Debates Championship in 2006, as well as judge for Team Pakistan at the World's Debating Championship in 2009. I welcome you on board, Mr. Ali Hannan. Now, moving on to the next team, the opposition team is made up of Mr. Ali Bin Amir and Ms. Hinamiya. Mr. Ali Bin Amir is a global telecom industry thought leader with long-term stints in multiple emerging markets across several continents. He has worked with global leaders such as PricewaterhouseCoopers, GlaxoSmithKline, Uganda Telecom, and MTN. It is this experience that we wish to tap into today and try to understand the gravity of his side of the motion. Finally, Ms. Hinamiya. Ms. Hinah has participated in various debating competitions and recently won the Novice Champion and Best Speaker Award at the Japan Debating Union National British Parliamentary Tournament. She was selected to join the Olympics Broadcasting Services production team for the 2020 Tokyo Olympics. She is currently enrolled at Sophia University in Tokyo, where she has co-founded the organization Horizon, which is a youth-led incubator for projects aiming to address social issues. Ladies and gentlemen, this panel is indeed very unique because all of us, including me, are former students of Beacon House School System, and we are indeed very proud of it. Now, let me share with you the rules of the debate. Each member from the two sides will speak for 6 minutes to validate their stance on the topic. After each speech, the opposite side may raise one point of information, which has to be a question. The same speaker which then answered the question who spoke before that, after each speaker has shared their points of view, one member from each side will present a summary of points. Now, as mentioned earlier, there will be a post-debate poll. I will share a summary of my own. Let's see what results we get at the end of the debate. Without further ado, let me invite the first speaker, Mr. Manik Elahi from the proposition. Mr. Manik Elahi, please, you're on.
Hello, everybody. Thank you very much for the opportunity to participate in this important conversation surrounding this global pandemic that is upon us, which comes with its own unique set of challenges. Let me get allowed to give some background on what's going on. You know, we had an inkling of what's happening right now with the SARS and MERS outbreak in several parts of Southeast Asia and Asia in general, but nothing like this. COVID-19 is different. You know, it allows us to see things in many different ways that we never have. It's reimagined life as we know it. For example, the total devastation as of yet, and it's only been a few months since we've been into this outbreak, is about 12 million positive cases and about 500,000 deaths. These are individual people, who have suffered at the cost of their lives. And, the proposition is going to be making the argument that we can have an economy that is safe. We can have a world that is safe, while at the same time tackling this important issue of completely eliminating, hopefully, COVID-19. And that is the stance that we take, which we believe we stand on the right side of history here. Now, let's go into the particulars of this debate. The first important thing to understand is what we're dealing with here. On one hand, we have dollars and cents, which essentially is money. And on the other hand, we have human lives, which is, on the proposition's point of view, invaluable. We cannot and we should not put a dollar amount on human life. And our case is essentially revolved on a life preservation centered economy, where we can have an economy that serves our essential needs as a society, as this global community, which is collectively suffering through this pandemic, but at the same time allowing enough protocols and safety protocols where we can have a safe reopening and a safe continuation until we get to either a complete treatment or, in an ideal situation, a vaccination which can be transmitted globally. So that's that. In our situation, the proposition believes that in a regulated economy, which we believe to be having standard operating procedures for, where social distancing is not possible, mandating masks to people, ensuring that there is, a safety standard that is met across our industries is extremely important. Because if we do not do that, it comes at basically the cost of human life, and that's something that we just cannot stand with. And we also want to keep in mind that if we reopen too soon and too irresponsibly, which, mind you, has happened in states like Texas and Florida here in the United States, we can end up very well with a terrible second wave of cases. So that's that. Now, if we do not do that, right, the couple of examples that I gave you kind of encompass that. But what's important is we also look beyond just that. I currently reside in New York. I've had a chance to work on the response to COVID-19 here. We went from the worst, epicenter in the world for COVID-19 to the best. Yesterday, New York State's tests came back only 0.87% positive. And, New York State is doing the most amount of testing in the world right now per capita. So something to appreciate when, smart public policy plays a role in people's lives. Now, the other thing to keep in mind is, especially in our most vulnerable communities, and this is especially applicable to our, our immunocompromised communities, where if we have an outbreak, our health systems cannot physically tolerate it. Imagine your local hospital. If you go into the emergency rooms, how many beds are there? 10, 15? Maybe at most 50? But what if we have 1,000 people come in? Just with COVID cases. This is not considering non-COVID emergencies that are legitimate and that can happen. So it's important for us to understand when the opposition stands on the wrong side of history, arguing that we can let people intermingle and, have higher transmission rates, have high positive cases, that is something that we just cannot stand for. And we will not stand on that side of history. And we will make the case that, health services are going to be severely at risk. There's not enough ventilators, there's not enough equipment. There's also, in many cases, not even enough medical staff. The most recent example being, the second kind of, 1.5 wave that we're having in Pakistan right now, where we had large breaks in Lahore and Karachi, which people are, experiencing, which our hearts go out to. But it's important to understand that there's an incredible amount of human suffering here. And if, the opposition does not appreciate the case that we're making here, that can lead to the long-term, basically disability that this economy is going to have, which they so cherish and want to, reopen irresponsibly. So that's something to understand. And at the end of the day, there's a couple of things that the proposition wants all of you to consider. On one hand, where we have, an opposition which is arguing and which is making somehow the idea that reopening this economy at the stake of, or at the price of human life is something that, we can easily stand behind, which the proposition does not believe in. And on the other hand, we have the proposition who is arguing with you today that there is a possibility, there's light at the end of this tunnel. We can get together, we can have the right precautions, we can save our people, our health systems in an effective way, flatten the curve, beat this virus, which is what we should be supposed to be doing. And one thing I just want to end with is, what are the example that we're setting? Are we going to, write on people's tombstones when they die that they died in the name of the economy? That's something that, that's what's at stake today. And with that said, I rest the case and I leave the decision on all of you and your very fine sense of judgment. Thank you.
Okay, thank you, Mr. Manik. So can we let people die in the name of economy? Mr. Ali Bin Amir, do you have a question?
Yes, thank you very much, Manik, for the enlightening speech. Just a couple of things I wanted to ask. I think if you would actually spend a little bit more time trying to convince us about specifically the benefits of your case, rather than focusing more on what the opposition will actually focus on, I think it probably would have been better. I think what I just wanted to ask you is, in terms of, you mentioned New York State now is down to 0.87, Texas opened a lot sooner. I'm just trying to understand in terms of, let's specifically focus on the US because that's where you're based, and I think that's where your comments are coming from. Who effectively is going to pay for all those, for example, lost wages, or for those poor people who now are basically daily wage earners, specifically in markets where governments are not as fortunate to basically give out $1,200 stimulus checks, every couple of months. So who do you think is going to pay for that, and how do you think are they going to pay for it? That's all I'd like to ask. Thank you.
Yeah, absolutely. Thank you very much for the question. And the idea that the proposition is, here arguing today is that you would not even have to end up in a situation where the government is giving out handouts. If you follow what we're telling you, is, have a safe reopening, have a safe economy where people can thrive, and also, mind you, have industries open, but just in a safe manner. And that is something that is of utmost importance here. And also, kind of going to your point about, different states reopening in irresponsible fashions, like New York State was a leader in tackling COVID-19, and it's kind of like a microcosm of the world. If Pakistan doesn't respond the right way, it affects Canada, it affects Bangladesh, it's going to affect India. So, that's what the proposition is arguing on the motion today. And we believe we're on the right side of history when we argue that, saving lives trumps just irresponsibly reopening the economy.
Okay, thank you, Mr. Manik. Some very pertinent points have been raised here. Okay, so next on we have the first opposition speech. Mr. Ali Bin Amir will be presenting the opposition's case.
Thank you very much, Amber. I think, before I begin, I think I just like to clarify one thing. It was said earlier that, the opposition is trying to equate the value of life in dollars and cents. That's not the case at all. Absolutely not. Whoever speaks about this particular topic in opposition will always be deemed to be a money-grabbing capitalist, which is what I would like to assure the audience, as well as my respected colleagues, that is not the case here. Look, this is one of those most difficult decisions in life where, like many other things in life, there is never a fully right or a fully wrong solution or an approach. It depends on what exactly is the particular point of view of an individual who's a decision maker and what the society in that particular environment is going through. So I think there isn't really a one solution fits all here. I think lockdown is a mini part of an overall solution that we all need to try and abide by. Now, having said this, why are we basically opposing what the proposition is saying? Look, if you follow what the study done by the Asian Development Bank, the report just came out a couple of weeks ago. This is not my figure. They've actually quoted that the global economy will face approximately a loss of $7 trillion in 2020 alone due to COVID-19 and its associated impacts coming predominantly from lockdown. Now, after a few zeros, they all look the same, right? But let me assure you, 7 trillion is a massive number. It's 7 times Pakistan's current GDP on purchasing power parity levels. Now, why are we so concerned about this? Specifically, from my particular point of view, there are 2 major issues. The first is the loss of jobs. When businesses go under, there's massive unemployment. So according to the World Bank, there are approximately going to be 200 million people who will lose jobs before the end of this year. Now, my respected colleague was speaking about the US. Just in US alone, in February, the unemployment rate was sitting at 3.2%. Today, it's, I think the last published June number is hovering about 11.1%. Now, it has come down from 14% agreed, but it's still a massive number, right? Now, what does unemployment cause, specifically in third world countries, where most of us have grown up and been educated? It causes poverty. According to the World Bank, within this year, approximately a minimum of 80 million people will be forced into the threshold of what they consider extreme poverty, which is $1.9 a day. Additional, today there are approximately 720 million people who are in this category. It's expected that another 80 million will be pushed into this level due to COVID-19 and the associated lockdowns. Now, developed markets like US, UK, and let's say the other G8 countries will rebound. It's expected that the rebound will happen probably beginning of Q1 next year. So 2021, the economic growth is looking like circa 4%, but that's on a global level. When you look at the actual people who don't have food to eat, when you look at people who are marginalized, the people that I'm talking about who will be forced to go into this extreme poverty definition. Most of them are in countries like Nigeria, India, Pakistan, Congo, etc. Now, there the rebound is not going to be in 2021. It will probably be in the latter half of 2022 at best, right? So, speaking from personal experience, having lived in 3 countries with large populations in emerging markets like Karachi, Lagos, Tehran, I can tell you it's not a rosy picture. We can sit and we can talk about what an idealist position would be. I always say practicalism eats idealism for breakfast, because at the end of the day, you have to think about those people who don't have money in the bank. People talk about New Zealand. So let's talk about New Zealand. They had only 1,500 or so cases. They had only 19 deaths. But the simple reason is their GDP per capita is $50,000, whereas a country, again, I'll come back to Pakistan, is only $1,500. So the guy doesn't have money in the bank to sustain a 46-day lockdown that New Zealand did. Now, why is this so important? It's important because we are looking at this from the perspective of being relatively more privileged than those people who are sitting on the road. So I would encourage, those of you who can, to basically go into these impoverished, let's say, neighborhoods in cities, which, let's say slums is probably a better word to call them, and take a bucket of food there with you to try and distribute. And I guarantee you will be overwhelmed within less than a minute, because they will all literally jump on you. That's the grim reality that we live in. So, we can sit and we can order everything online and get our groceries. My mother got her first delivery of groceries today, and she was very happy because she did it online. But think about those people who don't have smartphones. Think of those people who don't have the ability to go online. It's very important that we, as human beings, think about them as well. I think the thing that I really want to focus on is what has the lockdown. I think there's generally a consensus that there's basically been one global lockdown so far. So within that global lockdown, the one global lockdown that we've had, for example, look at the inequality of redistribution of wealth that has happened. Jeff Bezos has earned $28 million just because the price of Amazon stock has gone up. That is 10% of Pakistan's GDP on nominal basis. Look at China. When the oil price crashed, they bought so much oil that right now, if you do Google research, China has massive oil tankers waiting to offload off its shore. Their oil supplies are short for the next probably 5 years or so. So what have we done? We've made the people who already had means, people like Jeff Bezos as an individual, countries like China who have massive currency reserves, even stronger. Anyway, so I think I have very little time left. I think the point that I would like to make is people who have pensions, people who've invested in the stock market, people who need money now, how will they actually be able to live off their pensions when the stock market prices have crashed? They can't wait for 5 years for the stock market to rebound or to recover. Governments are bailing companies out left, right, and center. Right now, the US dollar is massively overvalued. Talk to any economist. The dollar is not worth the paper it's printed on. The way the euro is going with the 2 trillion euro package that was announced, it's going on similar footing. Anyway, so my time is up, and I rest my case.
Thank you for that, Mr. Ali Bin Amir. Indeed, you have presented some very pertinent and important points there. Mr. Ali Hannan, can developing countries sustain a lockdown to save lives, is what Mr. Ali Bin Amir said. Do you have a question for him?
I do. In fact, those figures, they do concern us. And I would agree that visiting the slums perhaps is something we should all do. But my question to you, Mr. Ali, is respectfully, all these concerns, understandably, they come from a place of facts, and so we can't deny them. My question to you, however, isn't whether this is happening or not. My question is, what's your solution? How would you approach this? And how do you think we are going to be best able to come out of this, keeping in mind the variety of sectors and the variety of demands that we will have to fulfill if the disease keeps circulating, if it's something that we do not eliminate? What's your plan?
So thank you very much, Ali. That's a very relevant question. I think, look, the most important thing is that there isn't one solution to fix this global problem. we keep, any country that says we've covered this problem, tomorrow there are a bunch of tourists. Let's say you open the amusement parks and a bunch of Chinese tourists who come in and they bring additional diseases. Just for your information, China has reported to the World Health Organization a couple of days ago, they've discovered a case of bubonic plague, for example. So this is now probably the new way we have to live our life. We have to ensure, I agree with what Manik said earlier, there has to be a combination. We have to practice social distancing, 100% aligned. We have to limit, let's say, intermingling as much as possible. We have to try and work from home as much as possible. We have to try and use digital technology as much as possible. But at the same time, for areas specifically in countries such as Pakistan, where there is massive unemployment, that you have to accept that there will be a certain spike until, let's say, a cure is available, and we cannot lock down the entire country simply to try and save a few people. So I think it has to be a combination approach. There isn't a one-size-solution-fits-all answer.
Okay. Thank you so much for that. Next up, we have Mr. Ali Hannan. Let's see how he builds his case. You're up, Mr. Ali Hannan.
Thank you, Ms. Amber, for giving me the opportunity. And I would agree with both the speakers who have preceded me that in many ways this is unprecedented. But I'm going to start with an analogy. In fact, that was my plan, but my plan kind of got disrupted, not just because of COVID, but because of something that I heard from the first opposition speaker. As in, we did research, and we perhaps all of us around the world have never been so keen to understanding what the situation is ever before, because not only is this something that affects all of us, and of course this is something that affects us disproportionately, but it affects us, all of us, enough for us to pay attention. That's something that Mr. Ali mentioned. We cannot sacrifice the economic needs of certain segments of society just because a few might get afflicted with, let me remind you what they get afflicted with. We're using the word COVID now, but let me use the right word. It's death. It's sudden, quick, unrelenting, merciless, and oftentimes without you being able to hold the hand of your loved ones, forever erased, irreversible death. And this few number, I'd like to contextualize before I address three things. Now, first, how these few numbers matter. Number two, how a disease-ridden economy itself necessitates certain SOPs that I think the team opposition seems to be in favor of, and where there is a trade-off between life and livelihood, exactly what kind of actions we must take and how to come out of this quicker and in a more sustainable manner. I believe the time to panic has passed. It's time to be reasonable and to, with a firm hand, move forward in the interest of those who are most affected by it, starting with those who died. So according to estimates, and I'm going to open up the range of estimates there, the fatality rate has ranged from anywhere between 2% to 4%, and beyond a certain threshold, it has been known, such as in the case of Italy, to hit double figures, 10%, 11%. And I'd like to analyze why that happens in just a second. Let's understand what this 2% represents. If you take a population of 1 million, right, that's nowhere close to the 220 or 230 million population of Pakistan. But let's start with like simple math. 1 million, right? 2% of that is 200,000 people, right? So if you just take any area, any city, or major city, and imagine hundreds of thousands of deaths there, that's what you're talking about, even with the low figure of 2%. Now let's extrapolate that to 100 million. That's 2 million people erased. Those are 2 million families without perhaps potential bread earners. Those are 2 million people who will never be able to recover what they've lost because there's no vaccine, and there will never be one, at least in the foreseeable future, for death. The economic revival contingent on bread earners, not so much possible for these people. Extrapolate that number, 4 and 10%, what does that happen? I'll tell you what happened in Italy. So beyond when there wasn't caution was thrown in the wind. And unlike New Zealand and maybe even to a certain degree Pakistan, Italy really waited for certain parts to be, certain evidence to be so damning that they had no choice because the political will was just absent. Their sense of urgency regarding maintaining the economic system overwhelmed them. And what happened was that people who could have survived avoidable deaths from COVID-19, well, that's the first segment that started to now pass away because they couldn't get access to beds, they couldn't get access to immediate treatments. And then the real disaster started taking place. People who would have to rush to hospitals. And imagine that. All of you must have experienced or must have heard of your own family members needing medical emergency treatments. Now imagine on your way to the hospital, you couldn't make it past the last traffic signal and you were told that you had to wait in line for maybe days. You had people passing away in your hands, number one. So that is something we want to avoid. And so let me sum up exactly what we need to do and why I think the proposition and opposition can agree on a few things. Number one, death is irreversible, and the health and well-being can be taken upon by governments all around the world, including that of Pakistan, because I believe if we can spend 1,000 billion, that's 1 trillion rupees on the defense budget, and allocate only a small margin of that to health, I think our priorities are wrong, right? We need to prioritize health in such times. Secondly, as far as economics is concerned, your same Asian Development Bank report noticed the hardest hit sector will be tourism, and the countries which will be disease-ridden are the least likely to recover in the prolonged future. And so prolonging the spread of the disease perhaps will worsen economic ability to recover. That's something you should perhaps keep in mind. And the last thing I would like to point out is that when poverty is abound, when the disaster strikes, we go into emergency mode. That we've done that in the situation of terrorist attacks. We've done that in the threat of dengue, right? We suspended normal operations so we could eliminate the threat, because we do know that this threat, as well as the opposition pointed out, isn't going to go away unless we make it go away. And how does it go away? Let me talk to you about it. COVID doesn't survive on most surfaces for longer than a few days. Look at whichever research you want to look at. It only survives for a prolonged period of time through a human carrier. And guess who has been spreading and terrorizing everyone in the economy and at homes? Ourselves. When we don't wear these masks, when we don't follow SOPs, where it becomes inconvenient, and where we do not sacrifice going, perhaps holding concerts, this becomes even worse. So I propose that as far as preserving health and life is concerned, even economic activity needs to be directed towards that. That's why the wage earners we're empathizing with, because it's the matter of life and death with them. But when you come and talk about only livelihoods, I think we need to make a sacrifice there. We need to tax our profits a little bit more. We need to keep up with these inconveniences, because everything in this economic system is now going to be centric on saving lives. And for that, we rest our case and proudly propose that going forward, we're going to restore our economy quicker. New Zealand has already done it, and it's about time we do it as well. Thank you.
Okay. Thank you for a very convincing argument, Mr. Ali Hannan. Ms. Hinah, do you have something in mind? Mr. Ali Hannan says that death is irreversible, and are our priorities right? Would you like to ask him a question?
Absolutely. Mr. Ali, you've talked to us about what death is. But what I'd like to ask you is, what does it mean to live?
Very important question, Hinah. Allow me to expound upon that. A few days, actually a month back, my own child, 2.5-year-old, tested positively for COVID. And then I reflected really on what really mattered to me. What really mattered to me was my ability to accumulate wealth. Or did it matter that in 2 weeks' time, will I get to see my child persevere? And then I thought about myself as well. And for me, living means being there and persevering. Being there for your community. That is something we've done in emergencies like floods. And if our quality of life does deteriorate, which it can, we need to prioritize the preservation of life via our community actions and government actions. As far as living is concerned, let me counteract with that another question. If living entails setting up a resort in a on an island, would you not want to clear the landmines before you want to go there and have a good time and to employ people? That's all we're asking for, and we know we can do it. There's no mystery around it. COVID only survives through human carriers. We know how to stop the transmission. New Zealand has already done it. East Asian countries have done a fantastic job historically and still are doing it. So why do we still have to debate that there's an even or if? The way towards living better is to first live and then to rebuild. That's where I stand.
Okay, thank you, Mr. Ali Hannan. May I now request Ms. Hinah to please present her case.
What does it mean to live? That is a question that I pose to all of you in the audience, because that is the root of the matter. And I find that the affirmatives' understanding, while I empathize with the suffering that they have witnessed, I find that their understanding is overly simplistic. Because we need to understand that there is a difference between existing and living. And some of you might be thinking, as Mr. Ali just mentioned as he replied to my question, that, well, survival is a prerequisite to living. What's the point of working if we're not alive? But what we need to grapple with is that as human beings, living in a certain way is a prerequisite to survival. We're feeding ourselves, clothing ourselves, providing for our loved ones is an inextricable part of what it means to survive. And perhaps that is why we have the phrase earning a living, because we recognize that we must function in a certain way in order to survive. And that is why, as the opposition, we are against lockdowns, because they strip away people's livelihoods and hence strip away a fundamental aspect of their survival. And we can combat COVID-19 by collectively and uniformly implementing alternative measures, many of which the previous speakers have talked about. It is possible to mandate adjustments in all sorts of spaces, in all spaces, public or private, and in all industries. And let me share with you the example of supermarkets in Tokyo, Japan, where you have lines marked at a certain distance to denote where people should stand in queues at the checkout counter. And beyond that, there's a need for mass testing, aggressive mass testing and mass tracing. The reason why countries such as Italy, UK, Spain are in the position they are now is because in the very beginning, and even right now, they're continuously failing to implement the comprehensive policies that all of us have talked about. Let us instead look to South Korea, Taiwan, and Japan as strong successes, because despite being close to the epicenter, China, they were able to overcome the pandemic without imposing a lockdown, without compromising people's abilities to put food on the table for their families, where Taiwan has only recorded 7 deaths, and South Korea, through aggressive mass testing and social distancing, was able to flatten the curve in just 20 days. Now, through my rebuttals, I will try to demonstrate why the affirmative stance is also self-defeating. And I'll do so by first analyzing that regardless of the timing of a lockdown, it is a sudden and extreme change that not only strips away freedoms from people and disrupts their life, but strips away their livelihoods. And that doesn't mean their ability to just afford a roof over their head or provide for their families, but the ability to afford medicines like insulin that they might need on a day-to-day basis to survive. And the failure of governments to respond is in part because the economic repercussions have been so great that they simply do not have the time and the resources to respond. Now, the anxieties, the uncertainty, the stress, the tension, the pressures erupt into a blaze of anger. And anger is a very powerful emotion. And it is wreaking havoc around the world, manifesting in anti-protest lockdowns in the UK, in Italy, in Germany. In the US, hundreds and thousands of people are marching with guns. In Italy, one of the places which was it really suffered. You still have people protesting, which shows you the extent of their anger. And by actively lashing out, by actively and intentionally going out in groups of hundreds and groups of thousands, not just in protests, but in their daily lives, they're exponentially putting other people's lives at risk. And that anger, that is something that we have to recognize. And the reason that is less likely to happen when you don't have a lockdown is because the change isn't sudden or absolute. People can still fulfill their basic functions. There's less of an economic burden for governments to cope with, and it's more sustainable because it allows for us to cope with even second or third waves, where these waves are more likely when you have consistent lockdowns, because when people come out of the lockdown, they're more likely to revert back to the problematic behaviors that exacerbate the problem of a third or fourth wave. Now, even if we were to disregard the successes of Taiwan, South Korea, and Japan, I still think that we have to look at this from a very nuanced perspective, because we have people angry people exacerbating the issue. But we also are not allowing people to work. But beyond that, we're exacerbating the suffering of vulnerable people. And these are groups of people that you will find that are not talked about in so many conversations about COVID. Because anger isn't just being manifested against the government, but it's being manifested against vulnerable groups, where scaremongers are exploiting people's insecurities, their anxieties, and their desire to gain the control that they have lost because of lockdown by amplifying xenophobic narratives. Around the world, hate crimes are rising. There's a 21% increase in hate crimes in the UK, in Australia, and Italy. In Malaysia, people are reacting against the Rohingya, refugees, people who have nothing. In India and Sri Lanka, you have people reacting against Muslims. And I want to talk about another group, women, who are disproportionately affected not just economically, but socially as well. Where so many women around the world, because of the lockdown, are being confined in the same space as their aggressors, as the people who are abusing them. And they're being put at an increased risk. Where in countries like the UK, Italy, and Spain, there has been a 30% rise in the case of domestic violence cases. I read an example of the situation here in Pakistan where a woman from a previously stable household was beaten by her husband because she asked for money to buy a sanitary napkin. And so what I'm trying to demonstrate to you is that we really need to look at this holistically. Because otherwise we're simply going to end up exacerbating the issue, and we're going to enable a tortured existence for so many vulnerable groups, and that is unacceptable, unjust, and cruel. And so the audience, I urge you to vote for the side that champions the lives of vulnerable people, that champions the inextricable part of living, which for so many people is to earn a livelihood. Because for them, having no lockdown, having a livelihood is what it means to have their lives saved. I rest my case.
Thank you for presenting your stance to the opposing bench. Very counter arguments. Mr. Manik, how would you like to approach the opposition now?
Yes, I think with much respect to the speaker that just spoke, I think she has unsuccessfully tried to tie every issue in the world with the lockdown. And I think that was interesting to watch. Not addressing, the fact that domestic violence happens not because of lockdowns, but because of abusive people, mind you. Regardless, what I propose is that in the countries that you mentioned, there have been regulation. There, you said, the standard operating procedures. People are following the guidelines and the guidance that their authorities or their local governments are giving them. So, my question to you is, don't you think all this was done to save lives?
I thank you for that question, but I'd first like to clarify, Mr. Manik, that just because you are not experiencing that kind of situation does not allow you to dismiss it. And what my analysis was trying to present was the idea that people are at an increased risk because the anxieties of being and the stress of being in the position because of a lockdown is what is increasing the chances of people becoming survivors of domestic violence. But towards your question, I think that what I tried to demonstrate throughout my speech is that we have to look at living through a much more complex way. I do understand that people, that the measures being taken place are because the situation is so extreme that you have to have a lockdown. But that cannot be something that we persist with or that we do. And we need to improve the way that governments are responding to this to make sure that people come out from the lockdown and are able to, truly live their lives.
Okay. All right. That brings us to the end of the individual speeches. Now, please can a member of from the opposition summarize whatever they have presented? Mr. Ali Bin Amir.
Yeah, thank you very much, Amber. I think, look, we're saying relatively the same things, but I think the only difference is the use of the word lockdown versus the use of the word, let's say, working smartly. So I think the most important thing that we would like to reiterate is that, unfortunately, in most of the countries in the world, including the developed markets, you cannot have sustained lockdowns without massive economic consequences on the population now and in the future. We are basically mortgaging our future for our now, if I can put it that way. I think the other important thing is that, look, we We didn't really discuss the impact on things like education, specifically again in emerging markets where children don't have access to online platforms, which people in developed markets do, for example. Are we willing to specifically look at our public sector education system? It's already quite poor. And are we prepared to actually let the poor children who suffer by closing their schools for another year and make them even more, let's say, uncompetitive when they compete with children who come from private school backgrounds? I think also it's very important to not to forget that, look, we have things like infant mortality rate, we have suicide, etc., which is all these things are going to increase because of the economic hardships which are going to be caused by lockdowns. So what we're just saying is we completely agree with the social distancing. We completely agree with trying to minimize social interaction. Hinah spoke about basically standing a few feet apart at the supermarket to make sure that you don't get infected. I think all of these things together, along with greater use of digitalization, are the only way forward. We cannot force everybody to sit at home and expect that the governments will be able to cater for them. I'm telling you that there will be civil unrest in countries which are relatively financially worse off, because people will come on the roads. Normal people who are driving. I mean, Ali was mentioning that his son got sick, and I'm glad to hear that he's well. All of us have, in some way or the other, been affected. My grandmother passed away because of this in a different country. Her body couldn't be brought back, and she was buried in that country. So I think we're all aligned here. The only thing we're saying is that, look, if the countries can afford to put people in lockdown and give them food, I don't think anybody will disagree. But what we're saying is, reality-wise, that cannot happen. And therefore, we have to take a systematic approach to try and counter this by taking all these different measures together and not in isolation. Thank you.
Thank you, Mr. Ali Bin Amir. Now, Mr. Ali Hannan, please can you present your summary for the opposition for the proposition?
I think the summary for the proposition was presented rather well by Team Opposition itself. I'm sorry, I'm going to accuse you of being a little disingenuous. I think your intent was on the right place, but there was an issue as far as taking upon the burden of what you perhaps were setting out to prove. And I'm glad that in my conclusion, I'm not going to disagree much as I'm going to point out that all your arguments actually support the idea that saving lives does trump, protecting and safeguarding livelihoods. And I'm going to start with what we agree on. What we agree on both sides is that we want to end this, ideally as quickly as possible. And for that reason, we look towards case studies from all over the world and what they deem as being different solutions. Let me point out what was common across all of them without exception. And I'll point out the ones in which perhaps livelihoods were prioritized over the protection of lives. And you can see the difference between what they're arguing actually supports the idea that lives should take precedence over going to work. So here's my issue. As far as South Korea was concerned, right, that was one model in which the economic activity was sustained. And that's, brilliant. But did you know that within South Korea, you were required by the government to test and then go in isolation, cut yourself off. If you can work digitally, fine. If you can't, well, there are alternatives that they were going to go for because they had a quick and speedy response to treating people. They had a quick and speedy response to addressing the needs. But the first priority was making sure the COVID was eliminated. And yes, I'm glad you brought out South Korea. Why didn't we go for that? And I'll tell you why. Number one. Number two, the only place that actually prioritized livelihoods over life was Italy. And I'm going to say this out loud, Mr. Trump himself. Why did not the problem go away in those countries? Why has it gone away in places like South Korea? Why has it gone away in places like East Asia? Success story from New Zealand. Because in each and every one of those cases, SOPs, the ones that you have pointed out, were prioritized. Now, you mentioned that we need to resume economic activity, but in the same breath you mentioned, we need to do this in the safest manner possible, and that is what we're proposing. We are not going to have concerts with no lines in between them. We are going to maintain economic activity only if it serves the preservation of life. And we are doing that. And why hasn't it gone away in Pakistan is because in Pakistan as well, we've been flip-flopping. Sometimes you have a lockdown, then they take it away. Sometimes you have a smart lockdown, then they take it away. Regulations are not being put in place because when they want to continue with economic activity, they do not make sure that these things are the prerequisites for entering the building. So the debate should be won because I believe, and my team believes, if you want to enter the building, you must wear this. You will forego a customer who does not come wearing a mask in favor of the one who wears a mask. That is what the debate is about. This is what is going to ensure that bread earners get the chance to earn for a living and are there to earn for the rest of their lives for the poorest and the most vulnerable. Not just rhetoric, not just this hullabaloo about livelihoods matter. And at the same breath, remember, masks are the only way to preserve livelihoods because they preserve life and they ensure that this will end soon and effectively.
Thank you so much, Mr. Ali Hannan and Mr. Ali Bin Amir. This has indeed been an excellent demonstration of some articulate arguments and some an exchange of passionate responses, really. Now that the debate is over, I would like you to again, I would like the audience to log in through live.sotevents.com and again become part of the post-debate poll. You can again see a button at the bottom of the screen. Please click on it and become a part of the poll. It has been enabled for you. Let's see how the arguments presented today have modified your thoughts, your principles, your philosophies of life, if at all. Have they been able to make you question the realities of today's pandemic-stricken world and what the future holds for us? Take a look at what both the sides have said and see what the outcome of this debate is for you. Because it's not just about global decision making, it is about individual decision making as well. And it is indeed not an easy choice to make. I'm going to give you some time. Please share your opinions with us, and we will be presenting the poll results right away. I hope you're all sharing your choices with us. We really would like to know how the audience thinks about the motion and how they think we should address this problem, which has become a part and parcel of our normal lives, the new normal that we are living in now, the post-COVID life and the post-COVID world that we are a part of. Okay, we have many people who have responded. Okay, so while you answer and respond to the poll, let me quickly summarize what everybody has shared with us today. Many thought-provoking points were brought up. Mr. Manik enlightened us as to why human life cannot have a monetary value attached to it. Mr. Ali Bin Amir presented illustrative statistics on the economics of the situation. In the second half of the debate, Mr. Ali Hannan painted a picture regarding how destructive COVID can truly be for those who lose a loved one. And lastly, Ms. Hinah argued that life is more than just existence. She also talked about the tortured existence of vulnerable groups. Now, we must be sure of the kind of values and principles we want to pass on to our coming generations. It is more than saving lives or economies. It is about saving humanity. It is about saving our belief systems. Are we prepared for the changes the new world dynamics will bring with it? We cannot always build a future for our youth, says Franklin Roosevelt, as is very, very clear in the current situation. But we can always build our youth for the future. So what kind of youth do we want to build for this new future that we seem to have become a part of? With extreme poverty forecast, $712 million instead of a pre-COVID projection of $595. Loss in productivity from 5.8 trillion to 8.8 trillion US dollars. The collapse of the tourism industry. Collapse of the hospitality industry. According to an article in the Time magazine on 9th July, 121 million more people could be pushed to the brink of starvation this year, not as a result of disease, but as a result of disruption to food production and supplies. And obviously unemployment. The report estimates that COVID-19 related hunger could cause 12,000 deaths per day. The peak global mortality rate for COVID-19 in April was 10,000 deaths per day. On the other hand, what are the high-stake decisions we will be taking when coronavirus has infected more people than the populations of New Zealand and Switzerland put together, with over 12.3 million infections, with almost 560,000 deaths because of the virus between now and the start of the pandemic in on December 31st, 2019, there have been 2 deaths to COVID every minute of 2020. Gives you goosebumps, doesn't it? Can we really think about the math of money? When you convert these numbers into names of human beings, fathers, mothers, friends, children, what gains precedence? We may soon face a dilemma, actually, an ethical choice. Opposite paths, both a direct consequence of the unprecedented global pandemic. As Robert Frost says, 2 roads diverged in the woods and well, which one gets traveled upon will remain to be a topic of worldwide debate for a long time. Let's see what the results of the poll are. Okay, this is really interesting. It seems that our debaters have not really changed your perception or stance. It's more or less the same. Okay, so that's very, very interesting. Let's see what the future holds for us. Even if a black and white solution is not still clear, we must always remember at the end of the day, our goal is to prevent the suffering of people. No matter what route we choose, human prosperity is our desired destination. With that, ladies and gentlemen, I would like to thank our esteemed speakers for joining us today and sharing their valuable insights on the topic. It has indeed been a very engaging session, and you have actually joggled our minds and made us think about our own belief systems and what is actually important that we need to prioritize. Thank you so much to all our viewers for joining us from all over the world and for contributing to the poll. A special thanks is due to Mr. Manik Elahi and our viewers from the US who have joined us so early in their day. Thank you so much. The conference will now continue from July 10th to July 12th, 2020, and we hope you will be attending other sessions as well to join our quest in researching the unknown elements which will change the future of our society at large because of the unique circumstances that we are in. Thank you, speakers. Would you like to say something in the end?
I would just like to point out that to all the listeners out there, please do your own research as well on the matter. And it is, even though it's a divisive topic, but I'm glad that one silver lining out of this crisis, and I'm not overall glad about this, is that we seek to inform ourselves and arrive at conclusions based on information that is available, using our reason and using evidence that was on display for a small amount of time here. But I hope that this is how we lead our lives as well. Thank you very much.
Thank you.
And I think just following up on that, I would like to add that staying informed will allow us to save lives. And really, I'm a person of faith, but we can't just leave this all up to fate. What we do today, the actions, the positive actions that we take today are going to affect how the numbers look tomorrow. So that is, the message for everybody. Stay safe, stay healthy. My prayers are with all of you. Thank you.
Thank you. Ali, anything? You have the next 10 seconds.
Sorry. Yeah, so I just wanted to actually echo what Ali and Manik have just said. Look, these are very, very difficult times for all of us, irrespective of whatever view we take here. I think the important thing is we all must, try and stay safe, keep our family safe, and just pray and hope that things, inshallah, work out at the end. Thank you.
Thank you so much, Ms. Hinah.
I just wanted to say that this is not an issue that affects just like a single person, but we're all interconnected in this struggle. And it's very important for us to empathize with the suffering of all the people out there. And that's what I tried to do when I talked about vulnerable people in my speech.
Thank you so much. Stay safe, everyone. Goodbye.